According to the World Health Organization, coronaviruses are a large group of viruses that can cause diseases such as cold or serious diseases as Middle East respiratory syndrome and severe acute respiratory syndrome. For example, a virus that is the cause of SARS was originally passed on by humans from a cat-like animal called a civet. Viruses may be transmitted from animals to humans. Nevertheless, they may be transferred in some cases from one infected person to another, as is the case with this outbreak. Let's see what are the signs. According to the United States, the new virus can lead to symptoms including fever, cough, and shortness of breath at the Center for Disease Control and Prevention. Many patients have only mild symptoms and recover, while others have life-threatening complications, such as pneumonia. The CDC says 2019 COVID symptoms will occur within 2 days or 14 days of initial exposure. When did the new strain started? In Wuhan, a town of 11 million people, the outbreak started. Many of the earlier patients are connected to the wholesale market of Huanan seafood, a large market for fish and livestock in the region. Nevertheless, there has been an ever-increasing number of people without exposure to the virus. According to the World Health Organization, the market was closed on January 1, 2020 for environmental sanitation and disinfection. How is it transmitted? Similar to flu, it is assumed that when an infected person coughs or sneezes the coronavirus that spread through droplets. In one case, 14 medical workers are said to have been infected by a hospital patient in China. It also appears that the infection can be passed on by infected individuals who have no symptoms. American health officers are suggesting rigorous and regular washing of hands to reduce the risk of diseases. We claim that there is little danger to Americans and no need to wear a facial mask as defense. How is the spread stopped? The World Health Organization assembled the Virus Emergency Committee in the Swiss capital, Geneva, and on Thursday the 30th of January it declared a global health emergency. In the US, the CDC has deployed public safety staff at 7 major airline ports of entry from Wuhan to screen passengers: New York, JFK, Los Angeles, San Francisco, Atlanta, Chicago O'Hare, Seattle, and Honolulu. It also carries on check UPS at further quarantine stations throughout the country, at airports, and elsewhere where health workers periodically check for signs of disease in their arrivals. Leaders of the coronavirus task force of the White House reported that any American citizen who has visited China's Hubei province in the past 14 days will receive 14 mandatory duty quarantine days after they return to America from February 2. Nonetheless, the U.S. is going to enforce a temporary ban on foreigners who visited the country recently. The CDC said that it has carried out a virus diagnostic test. The test is currently required by the CDC, but the agency works with domestic and international partners to distribute the study. Hospitals raised their level of warning and set the temperature control points for incoming passengers in Hong Kong, devastated by the SARS in 2002 and 2003. While China has shut down transportations to and from Wuhan and other cities, there is concern that the virus might spread even more rapidly when hundreds of millions of people have visited China for the Chinese New Year.